Dr. Lois Krahn is a professor of psychiatry in the Mayo Clinic College of Medicine and holds a joint appointment in the Department of Psychiatry and Psychology and the Division of Pulmonary Medicine. For the past 20 years, her clinic and research topics have been in the area of sleep medicine with a special focus on narcolepsy. Recently, her research has examined the role of wearable monitoring device, the sleep environment, and novel therapeutic agents for excessive daytime sleepiness. She has held several leadership positions, including Medical Director for Compliance and Risk Management. Additionally, she is a member for both the Mayo Clinic Board of Governors and Board of Trustees. She has received numerous accolades for her excellence in medical education. Dr. Krantz serves as the Director of Mayo Clinic's Center of the Science and Healthcare Delivery, focusing her education efforts more recently on this emerging discipline. It's a pleasure to welcome you, Dr. Krantz. How has it been possible to ensure that the fundamental elements of the Mayo Clinic in Minnesota have been incorporated into the newer site of Mayo Clinic in Arizona?
Thank you for that question. It has been a long and a thoughtful process. Mayo Clinic started in Minnesota, then added a campus in Florida more than 45 years ago, and then the campus in Arizona was created about 1 year later. A lot of careful consideration went into how to ensure that the newer parts of Mayo Clinic would incorporate the strengths and the culture of the Mayo Clinic in Minnesota. First and foremost, it's about the people. So we had a mix of people, some of whom transferred from Minnesota, others of whom were new graduates, and then we hired people from the surrounding communities. We are very much a value-based organization. It's something that determines our hour-to-hour decisions. So we were very careful to make sure that our commitment to our core values and our other values were incorporated into the new sites at the earliest time. Then we designed the facilities to really have a built environment that promoted teamwork and was very patient-oriented. And then lastly, we made sure that we had educational programs where we would be training the next generation, but needed to be very mindful of what our heritage is and what sets Mayo Clinic apart in terms of our value of the patient care is our first and foremost focus and comes first. And that we not only were doing it for the sake of our patients, but also training the next generation of healthcare workers, physicians and non-physicians, to keep that uppermost.
How is that Mayo Clinic in Arizona, that is considerably smaller in terms of staff and facilities, have been able to offer a wide array of high-quality services?
Well, let me say it at times is a challenge because our team is approximately 10% of the size of the team in Minnesota. Now, in some ways, we share resources. So, for example, we have an enormous medical library, and the primary location is in Minnesota, and we have those same resources available digitally at Minnesota and Florida and our other sites without it needing as many people and as much space in those sites. We have to be very selective in the staff we hire because we need them to be able to provide care to patients with complex and severe illness, but also be able to adapt and look after less rare diseases, more common diseases. And so we really ask our staff to be adaptable and stretch. And I personally think that that has made us very resilient.
That's fantastic. And how did Mayo Clinic in Arizona build its educational program in less than 40 years?
Another excellent question. We started almost without delay. We feel that educating the next generation of healthcare personnel is essential to how we operate and to the future of healthcare. So it was only a few years after we opened our doors that we had our first fellow. And in the case of Arizona, that was a fellow in foot and ankle surgery. We had faculty consultants who were very keen on teaching. We had an established patient base, and we felt that we could offer a high quality educational experience. Well, one fellowship led to multiple fellowships. Then we looked at the need for residency education, and we created residencies in general surgery and in internal medicine. Then we started the programs in other fields like neurology. And gradually we have built out our group of residents and fellows. So we have approximately 250 people who are in those roles at any given time. Then most recently, and this is the way we did it in Minnesota as well, we created a medical school campus. So we've actually started with the more advanced learner and gradually added learners who are closer to the beginning of their healthcare career over time. And now, as I sit here, we have elements of all 5 of Mayo Clinic schools operational at Mayo Clinic in Arizona. And I'm pleased to say they are very well respected. They are highly competitive. We get the best of students apply, hoping for admission. And we also get the best of teaching faculty who are very interested in being in an environment that is enriched and dynamic, where we're not only trying to look after patients, but trying to make sure that how we practice is on the cutting edge and that we're able to impart that to the next generation.
Well, thank you so much again, Dr. Krantz, for joining us today and sharing your insights on this very interesting topic.
Thank you. It's been my real pleasure to join you for this time.